a brief little circuit that you can do if you have an epidural, because if you have an epidural, you might be confined to certain positions in bed. So as long as you still have a bit of mobility, which you can do if you ask for a lighter dose or you don't top up the medication yourself too much, which we will go a lot more in depth into when we talk about epidurals later on, then you can still have some mobility usually and change some positions in bed with people kind of giving you some assistance in moving around. So you would start off the circuit the same as we were doing before, with having the ball up on the bed with you and just leaning on the bed. And this is a really great way to incorporate other comfort measures like massage and using the rebozo to shake the hips and help baby move down into the pelvis, or different things like that. And another simple massage technique that you can do is a little crisscross across the lower back, which can feel nice. And stay there for half an hour, 20 minutes, and then you move on to one side. So I will have Kendall lay on her side and put the ball between her legs. And if baby is still high up in the pelvis, then you want to have your thighs kind of straight flush with the rest of your body. So this position is good to do if baby is still high up in the pelvis. You can ask your care provider about baby's station, which they'll know from cervical dilation checks and feeling where baby is sitting in the pelvis. And so if baby is still up a bit higher, doing this position can widen the pelvic inlet. And if baby needs to be coming down the pelvic outlet, so say baby's head is already engaged, then you widen the pelvic outlet by moving your legs up like that. And then it widens this area of the pelvis instead. And you would stay like this for 20 minutes, half an hour. You could get little foot rubs, stuff like that. And then you move with you could either put, if you're in the hospital, which you would be if you had an epidural, or you can still use this same circuit at a home birth too if you have a birth ball. You can lift the bed up so that you're semi-sitting, or you can lean on the ball. So I will hold the ball for you to pretend that I'm the bed, and you can just lean your back against it. Because this way you are doing a circuit where you are putting pressure evenly on the cervix by having equal amounts of time on all sides. So this way it's helping baby put pressure on the bottom part of the cervix. And then you would do the same circuit on the other side for 20 and 30 minutes as well. And that wraps up our comfort measures video.